Hey everyone, my name is Finn. I'm a PA student, and I was also a 2024-2025 fellow with the LGBTQ PA caucus, and that's kind of where I got this project. So basically the aim of my project was to equip PA students with the tools necessary to intervene in instances of misgendering and dead naming of their transgender or gender non-binary patients in clinic, which is, it can be like a small thing, but it has like a huge effect on those individuals that have been misgendered or dead named. And so in doing so, I created this curriculum. Well, I'll step back. So why does it matter so much? About 3% of Gen Z identifies as transgender, and then about 1.5% of like US youth identify as transgender, and so it's pretty likely that these individuals are going to be in clinic. And in terms of misgendering and dead naming, there are two microaggressions that just have like incredible impacts on mental health, so much so that having even just one adult in your life as a trans youth can cut your suicide, that respects your name and pronouns, can cut suicidality by half. So that's kind of a little background on why it's important. And unfortunately, like a lot of PA programs and even other programs, medical school programs, don't teach specific skills to students on like how to intervene. So with that, I created a curriculum that really addressed 5 major objectives, I guess. The first being kind of just the use of affirming language, and then also just understanding kind of what the barriers that trans and gender non-binary people face in medicine, like understanding what microaggressions are, especially misgendering and dead naming, and their mental health, their mental health impact. And then really the meat of it was just focus on kind of the tools needed to recognize that, also intervene, and how do you do that so that you're kind of affirming your patient and providing safe spaces for them. So in doing so, I created the curriculum, and then I taught it to my classmates. So the class of 2026, there's 68 of us in total, 31 participated, so about half of us participated in the 1-hour training. And then before and after the training, I had people fill out a survey, basically asking questions like their confidence in providing care to transgender and gender non-binary patients, their ability to recognize these microaggressions and act on them, and then just their broader understanding of the challenges this patient group face in accessing healthcare. And so of the 31 students that participated, 100% of them actually agreed that the training was beneficial. And then 96% of them agreed or strongly agreed, so that's 26 people, that their understanding of these microaggressions and their impact had improved, with 77% of those, so 21 people, selecting strongly agreed. And then participants also reported that their confidence in intervening in regards to these microaggressions of misgendering and dead naming had improved. And then one of the questions we asked on the pre-survey was how much prior education did they have, like dedicated to a transgender and gender non-binary individuals. Interestingly enough, that amount of education didn't really have any significance, just kind of demonstrating that any small intervention can have like huge impacts for people's comfort and understanding of like how to do better, really. In regards to some limitations, I mean, it was a small study, 31 people, and it was only just at a single institution. And then there was the voluntary aspect of it, so there's some selection bias there with people that are more interested in the topic are going to come to the training. But I think regardless of that, it shows pretty good results of being effective. So it's my hope then to increase this and and teach it to the next class, and then hopefully it expanded out even further to other possible like PA programs, medical schools, and like residency programs, and then kind of just get more people learning about this and understanding kind of the real implications of misgendering and dead naming and kind of the impact they have. Any questions? Yes.
It sounds like you're focusing on expanding it to other PA schools. Would it be able to be taught to other health professions as well beyond just medicine?
Yeah, I mean, it can be taught to anyone, and it's interesting you asked that because a friend of mine actually wanted me to tailor it to her workplace. She has nothing to do with medicine, and so I was able to kind of just like tailor that learning and teach it to a small group of their colleagues, and it was still beneficial for them. I didn't do all like the analysis of that, but I got good feedback. So I think it can be tailored to like any group of individuals wanting to learn about it. Yeah.
I guess I'm just wondering if you like are aware of any mechanisms in which to make this like more of a mandatory training, because I fear like otherwise the people who like really need this training are not the people who are going to opt in.
Yeah. So I'm working with the PA program to try to expand it out to make it more like mandatory for everyone. It's just, it can be hard to fit it in somewhere. But yeah, I mean, it's definitely, I wish that we could have everyone take it.
As educators, we know how important the interest to learn and the desire to change is in the actual learning and the relationship between the learner and the student and the teacher. And so for me the interesting question so if you make it mandatory, you're kind of trying to teach something to somebody who doesn't want to learn. And that is, so from the philosophy of teaching, that's not the best approach. And so I wonder, the interesting part would be to see what you could change, or what the behavioral economics or the kind of implementation science perspective or whatever, why are these people not wanting to learn, and what could change in your curriculum to make them want to learn, because if you can change that, then you have won in many more dimensions than you ever wanted to.
I don't know the answer to that. How I can do it. I think it's fascinating, so I don't know why people wouldn't want to take it. But I also think, yeah, Joe, jump in, save me.
So I'm Finn's faculty advisor on this project. I know you are answering great, and I think an additional factor that you're bringing up though too are there other structural issues besides disinterest that are impacting people? Was it scheduled on a week that was very busy, so students were prioritizing studying for an exam versus coming to this? So that might not be. It's hard to differentiate the selection bias of participation. Are you participating because you're just a strong student, so you don't worry about dedicating your lunch hour to it? Or, so I think it's very hard to make the assumptions of like why someone doesn't attend.
Yeah.
And can we reduce structural barriers around that? And then what we were whispering about in the back too is we have also accreditation limitations on, I can't employ students to teach based on our accreditation thing. So I can't actually make this a required class and have Finn be the instructor of it while Finn is a student, because our accreditation body says I cannot have trainees as teachers. So there's a lot of little things here that so we can all go, yes, this is super important, and how do we get this to more people? And I think reducing other structural barriers is a short-term intervention for that, and then Finn can graduate and then move over.
Can I make a comment on that?
Sure.
I'm a genetic counselor. We had a genetic counseling, not here at the University of Utah, but in our profession of genetic counseling. Students did something on what was appropriate affirmation of transgender care, and it was part of her thesis project. And upon graduation, she published it and then made this online course that every genetic counseling training program can now incorporate into their curriculum. She doesn't get any money out of it, but like, so we make it a requirement as our program that they understand this thing. So I think they don't get a choice if they participate. Yeah, that's fine with me, so, but yeah.
And we've actually already talked to our chair about a way to modify this into a CME project so
Yeah.
that Finn can expand that to lots of folks.